Everything's working great. Oh, welcome. So today, me and Annie are going to be talking about maintaining a healthy headspace during challenging work and study times. I would really like to start with acknowledgement of country. Headspace would like to acknowledge Aboriginal and Torres Strait Islander peoples as Australia's first people and traditional custodians. We value their cultures, identity, and continuing connection to country, waters, kin, and community. We pay our respects to elders past and present and are committed to making a positive contribution to the well-being of Aboriginal and Torres Strait Islander young peoples, and by providing services which are welcoming, safe, culturally appropriate, and inclusive. I live and work on Wudandi Budja in the southwest of Western Australia, and I acknowledge the traditional custodians of my land, and I acknowledge any young people who are any people attending today who are Aboriginal or Torres Strait Islander. So, we're really excited to be here today from Headspace National Youth Mental Health Foundation. My name's Rob West, and I'm a clinical advisor at Headspace Work and Study. And I'm joined by my colleague, Annie Hogan, who is a work and study specialist at Headspace Work and Study online as well. And in today's session, we're going to be talking about the relationship between mental health and work and study. We're going to be talking about strategies for maintaining a healthy headspace during challenging times in work and study, which can certainly include when you engage in your new grad year. And from reflection, that was certainly a challenging time for me. And Annie's going to be talking through the clinically integrated work and study support, which is available here at Headspace. So a little bit more about us. So we're Headspace National Youth Mental Health Foundation. We provide early intervention services for 12 to 25-year-olds, and our services are across four core streams, which include mental health, physical and sexual health, alcohol and other drug support, and work and study support. And we have an extensive network of support of over 160 centres dotted around the country, which you can see by the little black dots. And we also have a range of online programs which increase our reach across Australia. And Headspace Work and Study Online is one of those online programs. So we really want to start off when we're chatting about mental health. We really want to talk about the mental health continuum and how stress and coping move us along this continuum. We think it's really important to highlight that mental health is something that we all have, hey? And just like our physical health, mental health can be thought of as sitting on a continuum. And different events will move us along that continuum throughout our life. Um, Mental health is how we think and feel and act. And at different times in our life, we will experience mental health difficulties, and many of us will have a mental health diagnosis. When we're mentally healthy, we can function and enjoy our lives and do all the things that are important to us and cope well at work. However, when we're experiencing mental health difficulties or mental ill health, this is when we have impacts to our ability to function. And so mental health difficulties is changes to how we think and feel, which impact our functioning, whereas a mental illness is a recognized diagnosed illness, which refers to major changes in a person's thoughts and feelings and behaviors, which impact their ability to function well. And I guess the key takeaway from the mental health continuum is that we're all constantly moving along this continuum, and stresses and life difficulties and big changes in our life will often move us towards mental health difficulties. However, positive coping and engaging in treatment will move us towards coping and healthy mental health. And the reality is that someone with a mental health diagnosis can can totally have healthy mental health, engaging in coping and the right treatment. So one of those things that moves us along the mental health continuum is engaging in coping, and the other one is stress. And so we really want to talk about stress and the impacts of stress, because it's particularly relevant when you're embarking on a big change in your life, or such as going into your new grad career. So we call this the stress bucket analogy, and it's a really helpful way to look at how stress impacts our mental health. It can be helpful for your own self-reflection, but also helpful when you're thinking about other people in your life and how they may be impacted by stress. So the reality is that, we will all be impacted by stress. And most of the time, there's early warning signs that stress is building up in us, and that we're having a tough time. And so that's why this stress bucket's particularly useful. So the way that it works is that we all have a certain amount of capacity to manage stress, and that's represented by our bucket. And then we have stresses, which is represented by rain and water, which fill our bucket up. And then we have taps on the side of our bucket, which is our ability to manage the amount of stress in our bucket. So everyone's bucket is different based on different things like your genetics, your early life experiences, experiences of trauma, how your parents role modeled stress management, and a range of other factors impacts the size of your bucket. And most of us have a bucket with enough room to manage a few stressful events at any one time. Some people have more room, some people have less room. As our bucket starts to fill up, we start to experience symptoms of stress. And the fuller our bucket gets, the more significant these experiences are. When our bucket is nearly full, it doesn't take much for our bucket to overflow, and that's when we feel really overwhelmed and unable to cope. And probably lots of people, I certainly do, have a memory of when something almost not that didn't seem like that big a deal, but had a big outcome. And that's because our bucket was probably already fairly full. So we're going to talk a little bit now about the stresses that fill up our bucket. And, stress is something that everyone experiences. Common stresses are obviously school and uni, relationships, difficult experiences such as bullying, and workplace stresses, and a range of other things, finances, housing, independent living. There's loads of things that we experience that fill up our bucket with stresses. Um, and the reality that a little bit of stress is totally good for you. A little bit of stress helps you pull off that deadline, helps you helps you get that assignment in. Um, However, a lot of stress or prolonged stress impacts our ability to do the things that are important to us and gets in the way of our life. So we really need to know the difference between a little bit of stress in our bucket and if our bucket's quite full or overflowing. And so some of the ways that we might be impacted by a really full stress bucket is we will probably have changes in our thoughts, feelings, behaviors, and sometimes physical manifestations of stress. And that just lets us know that there's a lot going on for us and that we need extra coping and support. And so some thoughts that might change, we might become more irritable, we might have trouble concentrating, um, we might feel anxious or nervous or worried, we might have trouble relaxing. Some behaviors that we might exhibit if our bucket is full or overflowing is we might be more withdrawn than normal, we might avoid social situations. And physically, when our buckets are overflowing or full, we may experience headaches or muscle pains, poor sleep, or always feel like I'm tired or fatigued. And and the reality is that everyone's bucket will fill up and overflow at some point in their life. That's kind of unavoidable. However, what we obviously want to reduce the times that happens, and we really want to avoid getting into a scenario of constant feelings of stress and overwhelm, where our bucket fills up, overflows, and fills up and overflows. We really want to be avoiding that constant cycle of stress because that really gets in the way of our life, our well-being, our ability to do things that are important to us. And it can also lead to the development of a mental health condition. So that's why we really promote at Headspace positive coping and engaging in supports. And so that's this is the fun part of the bucket analogy is our coping strategies and the way that we manage the stresses in our life. And this is never more pertinent than when you're going through, a big life transition. Um, so, like we said before, all our buckets are different. We all have different capacity and we show stress in different ways, but we all have the ability to manage the amount of stress in our bucket. Um, and so you can see in this slide that some of our taps are lower down on the slide and some of our taps are higher up in our slide. Sorry, so higher off in our bucket. And that's the reality that some coping strategies we use every day, constantly, to manage the amount of stress in our bucket. That can be things like, maintaining a sleep routine, good diet, exercise, social supports. But there's also taps higher up, and they're the coping strategies we use when we're noticing that our bucket is starting to fill up. And they can be things like putting in boundaries at work. They might be reaching out to a particular person that is really supportive that we can talk through our concerns or problem solve things with. It might be talking with our GP and getting a mental health care plan and speaking to a therapist. It might be talking to your GP and considering medications, depending on how long your experiences have been going for. So you've got a range of options. And we find that the higher up taps, by turning those on, we help turn the lower on taps on. And what that means is that by putting in a boundary at work, you might be more able to do your exercise routine after work. By talking to a therapist, you might be able to increase your sleep hygiene and improve your sleep. So basically, the takeaway message from this is that it's really important to have a range of coping strategies that you can use. And so this leads us into the 7 tips for a healthy headspace, which is um, Headspace has put together these tips, which are evidence-based. I'm sure they'll be really common sense to everyone here, but it's really useful to have them all in one place. And they're things like staying active, doing things that we enjoy, connecting with our family and friends, eating well, learning ways to handle tough times, getting enough sleep, cutting back on alcohol and other drugs. And like I said, these may sound kind of basic, but it's really useful to consciously have them all in one spot. So sometimes it can be helpful to pull up a healthy tips um, worksheet like this and have a think about, are there any areas in my life where I could increase my coping? I could turn my taps on a little more. And it's particularly relevant when you're going into a period of change or increased stress. How can I be more resilient with this change? What things can I do more of? How can I set myself up to manage the increased water that's probably going to be coming into my bucket? Um, and there's some great resources on the Headspace website if you want to look through this a bit more as well. And so that also now leads us to talking about the mental health benefits of work and study, because um, work and study is also a really useful tap in our bucket and the way of promoting good well-being. So work and study is a core stream of the Headspace model because engaging in meaningful work and study is so good for our mental health and is really protective for our health and well-being. And so as a result, our service really um, is designed to support young people 15 to 25 with making these decisions. Um, and we are early intervention, so we're available to provide that early intervention support when someone is having difficulty with work and study, having challenges in their career. And so by acting early, we can get that support in place and reduce the impact that stresses or challenges or mental health difficulties might be having on someone's work and study engagement. Um, and we really want to highlight, that engaging in meaningful work and study is so good for all of us, hey? So when a person is feeling anxious about their future, work and study really encourages hopefulness. And supporting young people in our role to explore their options and see possibilities can really reduce self-stigma. It can help people to develop a framework for structure and routine. Um, and provide a sense of purpose. Engaging in meaningful work and study can really empower people when it comes to achievements they make, such as and as well as having a plan, earning money, overcoming barriers. And so that's why we feel really passionate about our role in providing that early intervention support to people who need a bit of extra support around their work and study goals. And I guess a bit more information that we have is from surveys that we've done, and some of the data that we have that really is the reason why we do the work that we do, is we know that 75% of mental health conditions occur before someone turns 25. And we also know that young people with mental health challenges are significantly more likely to disengage from work and study. And a recent survey with Australian families found that 1 in 5 were concerned about the impact of work and study stress on young people's mental health. We also have some really exciting new research published that reveals that young people at Headspace who received work and study support alongside their mental health support were a third more likely to have better mental health and well-being compared to those who just received the mental health support alone. So that's really promising stats for why we do what we do. And the last slide that I'm going to talk to before I hand over to Annie is some information from a recent youth mental health survey told us some really valuable information about some of the challenges that young people are experiencing related to their work and study. And I'm sure the findings won't come as a surprise to anyone in this room. But obviously, cost of living and housing stability were really significant concerns and impacting on work and study. And only 1 in 2 young people felt confident about their current and future career aspirations, and only 39% of young people had high confidence in their ability to achieve their future goals. And while we recognize that engaging in meaningful work and study has really positive impacts on mental health, we also acknowledge that work and study can cause stress and concern at times as well. Um, and I guess the takeaway is that we really encourage people to reach out for that work and study support and look after yourselves, put in place your coping strategies when you're navigating work and study in your lives throughout your careers. Um, and now I get the opportunity to pass on to Annie to put a lot of this into to make sense of a lot of what I said, because she's going to be talking about insights from her practice in providing this support. So Annie, I'll you to introduce yourself.
Great, thanks, Rob. Hi, everyone. I'm Annie. I'm a work and study specialist, which is really just Headspace's fancy way of saying I'm a career advisor. And most of my days are spent helping young people navigate work and study problems that they might be experiencing and supporting them to achieve their goals as well. Okay, so at Headspace, we see work and study support as a whole of person approach, and we've developed a framework that reflects that. So, alongside our work and study domains, which cover tasks like writing resumes, cover letters, mock interviews, etc., we also cover topics like self compassion, motivation, work life balance, communication skills, etc. As highlighted by Rob, our work and study situation and our mental health and well-being are really closely related. And we found that many people often think that work and study support is limited to doing a resume and cover letter or applying for jobs. However, work and study support is much broader than that. We also have a lot of parallels in terms of the work and study support we provide and the mental health support provided by Headspace. So we focus on early intervention as this reduces the possibility of longer term unemployment and social disadvantage. We're strengths based, future focused, and person centered. So we work with young people to identify what they want to do, what their strengths are, and help them to focus on what they want to achieve in their future. We focus on building supportive relationships, as this is fundamental to good engagement and outcomes for young people. And work and study support has a skill development component. So we focus on applying skills in work or study while supporting the young people to learn by doing. And we truly believe that working or studying is possible despite mental health challenges. So, we're now going to move on to some practical tips and resources, and we'll be speaking about how we would frame these conversations with young people. So, perhaps you'll find some inspiration that you could draw from in the following slides. Okay, so as Rob mentioned as well, work and study can also be water filling up our bucket. So making choices about work and study can be really overwhelming, and the feelings of overwhelm can be increased by external things like family expectations, societal expectations, or lack of information. Um, you might recognize some of these thoughts or conversations on screen. Common stresses we hear about from young people are experiencing multiple rejections or being ghosted during the recruitment process, self-doubt about their ability to achieve their goals, having to maintain work or study whilst engaging in time-consuming job search processes, uncertainty about how long the job search will take, or just generally questioning current or previous work and study choices, which can impact on feelings of uncertainty about the future. So, understandably, all of these things can impact level of stress and mental health. Okay, we'll now run through some practical vocational tips that are drawn from practice and that speak to our whole of person approach. Um, so, to do this, we've included a case study of a typical service user called Alex. And Alex has reached out to us saying that I finished university last year and took some time off to figure things out. Now I want to get a job, but every time I start looking, I get overwhelmed and give up. It feels like there's so much pressure to have it all sorted. I've applied for a few jobs but haven't heard back, and now I'm feeling a bit stuck and unmotivated. I'm not even sure where to start anymore, and I feel embarrassed asking for help. Okay. So, some practical tips for Alex. So, really important to remember that finding a job is a marathon, not a sprint. So, we want to treat it that way. We're also not robots capable of creating dozens of applications every day. So, we need to take care of ourselves as people whilst we go through this process. So, some things that we'd encourage Alex to do. So, we'd encourage Alex to establish a balanced routine. So, rather than trying to do everything at once, we'd support Alex to take one small job hunting action each day, which might look like updating their resume, checking a job site, or chatting with a mentor. And at the same time, we'd remind Alex to make space for things that are going to support their well-being, like getting outdoors, engaging in hobbies, getting enough sleep, etc. We'd support Alex to set achievable goals. So instead of focusing only on the end goal of getting a job, we'd help Alex break that down into smaller, more manageable steps. So that might look like apply for 2 casual roles this week or write a new cover letter by Friday. And these kinds of short-term wins are really important for building momentum and keeping motivation high as well. We'd encourage Alex to make a plan. So we'd work with Alex to map out a clear pathway toward their career goals, identifying where they want to go, what steps they'll need to take, and what tools, like qualifications or experience, they might need to get there. And this kind of planning can help Alex stay focused, clear on what they need to do, reduce overwhelm, and adjust direction as their interests or opportunities evolve as well. We'd encourage Alex to seek feedback. So if Alex isn't hearing back from applications, we'd support them to follow up where it's appropriate and ask for feedback. While not every employer will respond, this process can also help build resilience and sometimes uncover some really helpful insights for future applications. And we'd support Alex to build their interview skills. So, knowing interviews can feel daunting, we'd offer Alex opportunities to practice, maybe through a mock interview with a specialist, with a peer or a support worker. And the goal wouldn't be perfection, but helping Alex feel more confident expressing their skills, strengths, and experience. Being able to answer interview questions with confidence is another example of a small win that we could celebrate together to keep Alex feeling confident and motivated through this process as well. Okay, so when you're unsure about what kind of job you want or you're feeling stuck like Alex, getting clear on your values can help you figure out what kind of work will feel meaningful and sustainable for you. Um, so how would we help Alex start exploring their values? So we'd encourage Alex to reflect on experiences that felt right for them. So we'd support Alex to think back on times they felt proud, fulfilled, or truly themselves in a particular environment or situation. And that might have been volunteering, helping a friend, standing up for something they believed in. Because these moments can often hold clues about what's really important to someone and can provide clues about what types of work, careers, industries, or organizations might align with Alex. We'd help Alex identify their non-negotiables. So if Alex already knows that they don't want to work in high pressure environments, we'd explore what that tells us. It might mean that they value balance. Talking about what they won't compromise on can be just as powerful as talking about what they want. We'd encourage Alex to consider the people they admire. So, whether it's a teacher, family member, or a public figure, we'd ask Alex who they look up to and why. Often, the qualities we admire in others, like kindness, creativity, or fairness, reflect the values that we want to embody ourselves and also provide clues about what careers, jobs, or fields might align. We'd support Alex to write down their values. So, getting the values down on paper helps make them real and easier to work with. We'd encourage Alex to jot down any words that feel meaningful, like honesty, freedom, growth, etc. Even if they don't feel directly related to work just yet, they're still important. We'd help Alex identify what doesn't align. So sometimes it's just easier to work backwards, process of elimination. So if Alex knows they're not motivated by money or competition, that insight could help us rule out options that don't align. We would support Alex to prioritize their top 3 to 5 values. So once Alex has explored a range of values, would help them narrow it down to a few that really stand out. And these core values can help to act as a compass, guiding decisions about types of roles, workplaces, and pathways that align. Okay, so as we demonstrated when talking about the analogy of the stress buckets, there are many work and study related factors that can increase stress at times, and this stress can come from a work or study environment or from our external life and can have direct impacts on our engagement and participation. There are also going to be times where things don't go our way, so we may fail at things in our work and study life, including failing assessments, not getting marks needed for uni, or perhaps not getting the job or internship that we wanted. And this can impact how we feel about ourselves. So for Alex, we know that job hunting can be emotionally draining, especially when motivation is low or things aren't going to plan. So we'd help Alex identify signs of stress and explore how their mental health may be impacting their motivation and engagement with job search activities. We'd encourage Alex to consider what their taps are in their stress bucket and collaboratively develop a plan to integrate these coping strategies into their daily routine and job search. We'd promote healthy habits. So I believe Rob showed the slide before of our healthy habits, 7 tips for a healthy headspace. So things like eating well, exercising, getting enough sleep, which reinforces that daily self-care builds focus, energy, and emotional well-being, which is only going to support your work and study activities in the long term. We'd explore Alex's current support networks and how informal and formal supports can align with and strengthen their work and well-being goals. We'd also support Alex to open up in safe spaces by practicing conversations and encouraging small steps towards sharing their thoughts and feelings with others who can support them as well. And we discuss accessing mental health support options alongside work and study support. So within our service, these supports are integrated. In other cases, we might encourage someone like Alex to speak with a GP about a mental health care plan, or accessing an employee assistance program, or using student wellbeing services through university as well. Okay, so just to summarize our work and study support options. So Headspace National provides 3 types of specialised vocational support that are all free. So we have an in-person option at 50 centres for 12 to 25-year-olds. We have an online work and study program for 15 to 25-year-olds and an online industry mentor program for 18 to 25-year-olds. And across these 3 programs, we can support young people at any stage in their work and study journey. And we acknowledge that the strong interrelationship between mental health and work and study is important. Okay. There are also multiple entry points to work and study online and career mentoring. So, for work and study in centres, young people need to be connected to clinical support within the centre in order to access those programs. But if you'd like to access one of our online work and study support or career mentoring programs, you can jump on our website and directly book with the specialist or submit an expression of interest if you just want more information about the program first. Or you can give our toll-free number a call as well, and either book in with a specialist or just have a chat about the program too. Cool. So Headspace has significant resources available via the website and Headspace account. So young people, families, and providers can jump online at any time, create a Headspace account for free, and get access to our suite of mental health resources, speak to mental health clinicians online, and engage with interactive activities and peer chats. We're conscious that there may be some over 25s in the room, so if you are seeking either career support and you're over the age of 25, we highly recommend looking at the Australian government's Your Career website. And if you are seeking mental health support, you may be able to connect with an EAP service through your employer, or you may like to check out the Medicare funded mental health centres available. Okay, and I'll hand back over to you, Rob, for closing.
Thanks very much. Thanks, Annie. Yeah, and now it's time for Q&A. We're happy to take any questions. Yeah, Alex, I'm happy for you to direct.
If nobody wants to, you can either put your questions in the chat directly, you can come off mute. I'll do the teacher wait of, a couple of seconds to see if anyone does. But if not, I have heaps of questions.
Oh, no
So,
worries. Great.
so you can put, maybe I'll get things started a little bit. We've got about 9 minutes. Yeah, I was wondering about, very specific question, but what do you guys recommend about, say you're in your first role or whatever in the workplace in general, you're a young person, and should you be talking to your manager, say, about your mental health? What do you recommend there from sort of like a professional point of view, I guess? Do you talk about your mental health in the workplace, or do you keep it to yourself?
Yeah, and disclosure is a big one that we talk a lot to young people about. Annie, happy to answer this question with you, or yeah, you probably have more disclosure conversations than I do, but I have a fair few as well.
Yeah, so I think I'm going to give a little bit of an annoying answer, but I think it depends.
Mm,
Um, there are probably certain conversations that it might be worth considering. Is my manager the best person to have this conversation with first, or should I perhaps talk with a GP or perhaps at some other qualified mental health professional before sort of bringing this to a workplace? But yeah, in certain cases though, disclosure might be required. I don't think I have more to say
Yeah,
about that though, unless Rob, you do.
yeah, I mean, I have a little bit just to add to what you were saying. I mean, in most situations, it's not required. You're not legally, even when you fill in and it says like, do you have anything to disclose? You don't have to disclose your mental health
mm.
unless it impacts on your work. Really in your safety at work is I think the legal stipulation.
Yeah, I
And
wonder,
for
I was just going to
most
say,
people, that's not the case.
yeah, I was just going to say, like, for people that haven't started in the workplace yet, you might not know this, but often you might get, when you start a job, a form that you have to fill out where they ask you what your mental health conditions are, and you're saying, Rob, you don't need to disclose. Yeah.
Unless you have
Right.
a condition that, say, you might have a condition where you take medications and that
Yeah.
impacts your ability to drive, then in that situation, yeah. So
Yeah.
situations like that, but for the majority of people with mild to moderate mental health conditions like anxiety and depression, you don't have
Yeah.
to disclose that. Um, yeah.
Yeah. I have
Um,
another question.
and then, like Annie
Oh,
was saying,
sorry.
you can then choose if you think your employer is going to be supportive and it's going to be useful, then you can. Sometimes people wait until they get the job to figure out because it's hard to know that in the interview.
And you can ask in the interview as well, I should say.
Yeah.
You can literally ask in the interview. And in fact, I think that this shows, personally, as someone who hires, that this shows a lot of self-awareness is, or not even self-awareness, but just a sort of caring point of view. What sort of mental health supports does this workplace have? what, you know,
That's a great question.
what mental health, health and safety do you guys do? What policies do you have? Those are all great questions to ask, especially because I can see all these participants in here. Everyone who's chosen to do this workshop, as opposed to some of the other ones, is probably either going through the job application process right now, which is so stressful, can be so stressful, or start, still at uni, or still even, I know some people are joining who are still in high school. So I think that's really speaking to some of the anxieties that young people are having today about entering the job market. Have you guys been noticing that there's been a jump in, because I hear a lot in my position about how young people, graduates, even actually career changers are feeling about the job market today? Are you noticing a big jump in anxieties?
Yeah, definitely. I think particularly things like AI and how that's going to impact certain jobs and certain industries comes up a fair bit in my conversations with young people. Um, yeah, and things might feel a little bit more uncertain right now than they have in past years. And yeah, I think developing a skill set or a toolkit to kind of help you manage your mental health and stay in a good place is really important.
Um, I also have another question, which very quickly about if I remember when I was entering the workforce, how do you deal with comparison to, say, your friends, people that you went to uni with who everyone seems like they're getting a job really quickly and you're not? How do you deal with that, like sort of the effects of that comparison element when job searching?
Yeah, I mean that's a great question, and yeah, compare and despair, and often people are in these bubbles, hey, and it can be helpful to have wider conversations outside your bubble, and also it's easy to say, but it's important to run your own race, and people achieve things at different times, and also you don't really know the inner workings of someone's life or how they think and feel, and um, you know. Um, spoiler alert, lots of times people are doing cool things with lots of fear and anxiety, but you're not in someone's mind, so you can't tell. When someone's doing a presentation or something, you think they're just really chill, but they're not. They're most of the time people are scared and they're doing it anyway.
Yeah.
Um, so I don't know if you have anything to add to that, Annie, when it comes to that comparison, because I know we hear a lot about that in our work roles.
Yeah, no, I think you summarized that perfectly, Rob. My only advice would be like if it's social media or like LinkedIn, mute who you need to mute.